Hi, my name is Greg Fell. I'm Director of Public Health. This is a short clip about the Outbreak Control Plan. You'll hear a lot about the city's Outbreak Control Plan. It was an ask made of us by government. We've taken the ask pretty seriously as a city, and many of my team and lots, well beyond my team, have been working very hard over the last few weeks to develop this thing. First up, the clue is not in the title. This is not about managing outbreaks narrowly defined as an outbreak in a school or a care home or a workplace. For sure, they will happen, but really, what the plan is about is managing the transmission of the virus, regardless of where that is, and keeping opportunities for transmission low, so that we can give the city confidence that we can open up, we can unlock the lockdown, and in doing so contain the spread and keep the level of circulating virus low. So we've set up the outbreak control plan on three broad principles. Stop it. Prevention is obviously better than managing it once it's happened. No, so surveillance, both the hard data, but also the soft intelligence that comes from lots of places, and respond appropriately. So yeah, we will have a continued push on some of the core prevention messages that will remain important throughout. Local testing capacity is important, and get local accessibility is important, and we're continuing to push that. In every decision we make, we will be thinking about what's the potential here for transmission of the virus. Of course, thinking about high-risk places, high-risk communities, and there are plenty of those. Care homes are one of them. There are plenty of others. So getting our data and our surveillance system up and running is important, and it's fair to say most of it's up and running now. There are some improvements I'd like to make, but most of that's up and running. The key question is, how will we know that the virus transmission is growing? It's crucial to lifting restrictions and crucial to keeping an eye on what happens when we do lift restrictions. We need to pick up cases early before cases become clusters, and pick up outbreaks early. We will manage them aggressively. We've got a fairly standard set of operating protocols for managing outbreaks in lots of different types of settings. They're applied in a nuanced way depending on the conditions on the ground of the day. Of course, we've got to make sure test and trace works. That's an NHS test and trace service. It is not my service. It's working on behalf of the city, and my job is to make sure it works as well as it should. The bit that often gets forgotten is the isolate bit. If I've been recommended to isolate by NHS Test, Trace and Isolate, I should say, that's because I may have been exposed to someone who has this illness, and I may be incubating that illness. And we know that there is a phase that is the asymptomatic phase where I can be infectious to others, but I don't even recognize the symptoms. So if I'm recommended to isolate, and that does mean be at home. It doesn't mean go to the shops. It doesn't mean go to the cinema, as and when we get the cinemas back open again. It means be at home. So there's a key message for all of us there: don't be a contact. We will be supporting the reach of that service into our communities, and we'll keep the comms going throughout the year. So collectively, that's the outbreak control plan. And that will be published online in the not too distant future. And that's managed by something called the Outbreak Control Board. That's led by the leader of the council, Councillor Dorr. Has a wide membership, and the membership is designed to give us an opportunity to get into how communities think and behave, and how do we influence communities. And collectively, that gives us the ability to understand what makes different communities tick in this regard, but also how to influence different communities. The thing we're trying to avoid is exponential growth. So if R, which is the number that is often used, it's an imperfect number for lots of reasons, but if R goes above 1 and we get indications that the virus spread is growing again, then we get into the space where we think about putting back in more restrictive measures. No one wants that. No one thinks that's a particularly good idea. However, I don't have to remind anyone what exponential growth looks like. We've seen that in late February and early March. Nobody wants to go down. Nobody wants to go back there. Another lockdown will be economically and socially damaging, and we need to take responsibility for avoiding it. All take responsibility. So collectively, all of that gives us a chance of keeping flares and flare-ups localized and containable. If we don't, then that gives the epidemic more chance of escalating, and it becomes much harder to control. And as I say, we've seen what happens there, and we don't want to go back there. So the next 2 months are going to be really important. Winter is coming. all of the conditions needed for a second wave are present. We must keep we must reduce and keep the infection rate low before the autumn and winter, because the infection isn't going to disappear. It is a global pandemic. We've seen it's accelerating in other parts of the world. Coming out of this is going to be much, much harder than the lockdown. Of course, it's a balance of risks. We can't stay in lockdown forever, so there's no option that is risk-free here. But our job is to help us all reduce the risk for ourselves, our families, and our communities. So changing the fundamentals depends on continued respect for physical distance and isolation, fast and accurate available diagnostics, treatment, vaccines, which, as I say, are some time away. So we have to do some of that stuff. Everybody in the city has to do so. I can't secure success here if everyone just pretends it's all over and goes back to how we behaved a year ago. We will be living with COVID for some considerable time to come. So while science is the exit strategy and probably will deliver, it's not going to deliver as quickly as we want. So we're going to have to live with some of the fundamentals of how this virus works for quite some considerable time.